Welcome to True Health Tuesday, and the truth will set you free. Future of healthcare, and this is the neat part. So this is going to be part 2, but we're going to talk about blood health. And what I mean by that is we need an objective analysis, because when we did the study on or the lecture on immune systems, there's no way to measure an immune system. Like last week, I had a fantastic immune system. I mean, amazing. I was producing mucus, sweating like crazy, diarrhea. I mean, it was absolutely fantastic. And that's what you want. Okay, so I developed antibodies that I'm going to remember that virus and any similar viruses for the rest of my life. Okay, this is cool. That's how an immune system works. See, in psycho world, you suppress every symptom. You change every symptom. And that equates to what we have. We have an autism epidemic, we have a dementia epidemic, we have a chronic disease epidemic, and this is going on exponentially. Because the therapies that we're choosing to do are suppressing symptoms. Well, I'm going to go through and run through a few case studies to show you how to look at it. Like, how would you measure your physiology? You know, do you wait for symptoms? You know, because I mean, that's what people will say. Gee, doc, I was going to bring my kids in. You know, when should I bring them in? I said, well, wait till they're really sick. You don't want to help them when they're healthy. Sarcasm? Anyone? Yeah, it's like nuts. Okay, so this is what we're under. And if you could boil down every stress, yes, this includes ex-wives, this includes everything, okay? Physical, chemical, and emotional stress. Here's the rub though. Okay, when we're looking for a chronic disease causative factor, okay, knowing that 60% of our population has a chronic illness or disease, 54% of our children have it, so what is the causative factor? It's this. And I'm going to show you how this is, how your body responds correctly based on this. I know that sounds odd, but now let's look at this. Psychological stress. Okay, and this is just, remember, we got 3 stressors. We got physical, chemical, and emotional stress. When your body's under stress, you're getting ready for battle. Okay, might you be injured in battle? Absolutely. So the platelets increase. Also, do you need stress hormones when you're in battle? Absolutely. Cholesterol is going to go up. Blood pressure is going to go up. The liver is going to start breaking glycogen down to glucose, so blood glucose goes up. So this means blood viscosity, the thickness of that actually goes up. This was a really cool study where they just gave people math problems, okay, and put them under stress for just, a short period of time. And they said, oh my God, blood viscosity increased, the serum lipid concentrations or cholesterol increased. Yeah, because this person's getting ready for battle. But what if you go home and you have stress? What if you're eating food and you have stress? So we have to look at this, that this is how the stress response is. We've got an automatic nervous system. One part keeps you alive under stress. That's the sympathetic. That's actually located in the rib cage area, T1 through about L1, L2, around there. And the parasympathetic nervous system is rest, digest, and repair. That's located in the sacrum and upper neck area. So you can have an actual trauma there and have that area negatively affected. But your body is designed to utilize this system to adapt to the environment that you perceive, not what's actually happening. So if you think that skydiving is just absolute joy, you're going to be loving it, okay? You're not going to be in a pathologic state. Okay, if you're like me, you figure you're going to go one and done, okay, please God, get me on the ground, okay, then you're going to be in a sympathetic dominant state. But this is physical, chemical, and emotional stress. Your body's going to respond exactly the same to all 3 of these stressors. So that means under chemical stress, so you just ate, a bad burger, okay? Or you're emotionally upset, you're thinking about the bad burger, okay? Or you're chemically upset. The sympathetic or fight or flight is going to kick in. So what does that mean? That means the blood pressure is going to have to be elevated. The heart rate's going to be elevated. The blood sugar is going to be elevated. Cholesterol is going to be elevated. blood supply to the gut's going to be shut down. And this is going to be the exact same response for physical, chemical, and emotional stressors. So that seems odd, because in our society then, is high blood pressure a disease, or is it an adaptive physiologic response? Is constipation or slow gastric motility an actual disease, or is it an intelligent response by the body? Is high cholesterol a disease? What is broken in the body that the body can't regulate cholesterol or blood pressure? Or is there nothing broken in the body and this is a normal stress response? Okay, let's take the blue pill. Okay, because this is a trip, because if you treat the adaptive physiologic response with a chemical that has myriad of side effects, you cause more toxicity to the patient and you increase chronic disease. Could it be that simple? Could all we got to do to reverse this chronic illness and disease epidemic is to deal effectively with the physical, chemical, and emotional stress? My God, that's incredible. Voltaire, doctors are meant to prescribe medicines of which they know little to cure diseases which they know less in human beings whom they know nothing. See, this is a dogmatic approach. One of the things that we have is I talk to my doctors, we train all the time. Okay, these guys are the best on how to communicate. And when you think about it, there's a lot of, like when you're given a medication, okay, if you develop an effect from that medication, some people call them, side effects. Okay, so yes, the Sinemet drug for Parkinson's will slow down this, but it will make it worse and it will get much worse. The side effect of antidepressants is suicidal thoughts. The side effect of aspirin is kidney damage and increased stroke. The side effect of every drug is going to give you the symptom that it's designed to treat. So when 106,000 people a year, every year, die of the right drug at the right time in the right dosage, 106,000 people a year, how come no one is getting arrested? Do you want to know why? Because they're following the standards of care. They have the right diagnosis. So if you gave them a combination of medications that killed the patient, stroke them out. We just had a patient today that was going to pain management. You know what that is, baby? Drugs. Okay, pain management, 30 years of opioids. Okay, what does that do to brain function? What does that do to body function? 30 years of opioids. Okay, a good, healthy person, no. And so then they got her on methadone because you got to get them off the opioid crisis. Then she stroked out from the methadone. But no one's going to get arrested for this. So she's had a stroke, brain damage, everything else from 30 years of pain management with a neurotoxic component. Okay? How come no one's getting arrested? Because they're following the protocol. Okay, it's a diagnostic protocol. Okay, you had this diagnosis, and I followed what was appropriate. Now, how many people know? I mean, you figure the average person over 60 is taking 12 different prescriptions. Nobody knows what 2 drugs do together. And you're talking 12? So this is a chemical assault. So when we talk about treating an adaptive physiologic response without addressing the stress and with a toxic chemical that has danger, well, let's just look at this. Cholesterol. Okay, now we know cholesterol is involved in hormone production. We know it's literally helps emulsify fats. I mean, this is the precursor to every stress hormone you make. It's the outside covering of every cell you have. Okay, it makes you make the glucocorticosteroids, mineralocorticosteroids, sex hormones, everything out of cholesterol. But if you give a drug to lower cholesterol, is cholesterol elevated under stress? Yes! What kind of stress? Physical, chemical, emotional stress? Yes! So if you have high cholesterol, does that mean you have an inflammatory process or stress? Yes! You got something going on. But in dogmatic, stupid world, we give you a chemical that lowers it. And what do you get if you take that chemical? According to the expert review of clinical pharmacology, you get atherosclerotic formation. That means your arteries are starting to harden, and heart failure. Okay, that's bad. The epidemic of heart failure and hardening of the arteries, atherosclerosis, that plagues the modern world may be aggravated by the pervasive use of statin drugs. This is the Center for Disease Control in Atlanta. I mean, the actual CDC, these guys say, look, guys, the population of America is really sick. 60% of everybody in America has a chronic illness or disease they'll never recover from. It's one of these conditions. Okay, oh, I forgot. What was the cholesterol drug? What does that cause? Atherosclerosis. So let's look at the list that they have. Heart disease, what's the leading cause of that? Atherosclerosis. Or lifestyle. Cancer. You can have a cancer gene, but you're not going to develop it. Cancer just comes from something. They don't know. So let's just call it environment or cause. Because you look at carcinogenic warnings, environmental toxins, chronic obstructive pulmonary disease, environment and lifestyle, strokes. Again, strokes, the hardening of the arteries. So does that mean that everyone that's taken a cholesterol-lowering drug is increasing their risk of these chronic illnesses or diseases? Yes, but no one's going to get in trouble for prescribing you that because they're following the standards of care. Alzheimer's, lifestyle factors, cool. Type 2 diabetes, lifestyle factors. And type 2 diabetes, is that a disease when you can change your diet and it goes away? Chronic kidney disease, what's that from? The high blood pressure and diabetes. So it seems like lifestyle factors. So people, give me comments and they say, look, I don't want to sit through a 45-minute lecture. Okay, just tell me the damn solution. This is the solution. We got 3 causes of stress that's going to elevate cholesterol, weaken your immune system, predispose you to chronic illness or disease. Okay, it's the solution for high blood pressure, type 2 diabetes, inflammatory bowel disease. This is the solution that's going to help prevent brain damage, Alzheimer's, and dementia. This is all the solution. You deal effectively with physical, chemical, and emotional stress. No, it can't be that easy. It is that easy. It's like, holy shit, really? So we don't cover up the symptoms, we just appreciate it and get the body working correctly? Yes, that's true. So the physical stress, you got to look at the physical. You got to take a digital x-ray of how the body is weight bearing. And if you see something funky, you got to go to a guy that's going to correct that lateral deviation or forward head carriage or degeneration. So you fix the structure, and the structure is going to equate to a neurologic problem, so that's going to be you fix the structure and neurologic together. Chemical, respiration, perspiration, pooping and peeping. That's how the body detox the system. You have chelation, oral chelation, you can take stuff in your mouth, vitamin C, chlorella, spirulina, diatomaceous earth, charcoal. There's a bunch of oral chelating agents. But first you've got to identify the problem. Okay, and then you've got sauna, because you've got respiration, perspiration, pooping and peeping. And we're going to go into kidney disease in a little bit because the blood is so sick and toxic in Americans. This is what's contributing to every kind of problem you can imagine. That's why we're talking about blood health, because we all got blood. Okay, so IV chelation, oral chelation, sauna, and I should have put on the chemical toxicities as other than ETC. Don't poison yourself. If you put something in your mouth that at a large enough level will be toxic, okay, like a pill, okay, or toxic food, it can build up to toxic levels in your body. Does that make sense? Okay, we're just talking common sense. And not dogmatic approach. Not your blood pressure was this, you need this diuretic. Okay, we're talking common sense. Common sense is your blood pressure is high, you must be under stress. How many bowel movements a day do you have? Wouldn't that be common sense? Okay, and emotional, you can rewire the brain to change the emotions where your chemicals, because the emotions are chemicals secreted by how the brain perceives the environment, not what's actually happening, and you can rewire that. Emotional freedom technique, neurolinguistic programming, cross-crawl exercises. When we talk about brain health, you know the cerebellum in the back of the brain, it gets all the movement from your body, stimulates into that, and this can control the frontal lobe. So you're talking movement can help with anxiety, stress, depression, impulse control, everything. Wow. So let's just look at kidney disease. So the blood of Americans is like ridiculously toxic. 14% of Americans have a chronic kidney disease. Now, what is a kidney? A kidney is so cool. It's the size of your fist. It's a blood filter. So that means that our blood is toxic, poisonous, or something is going wrong. Does that make sense? Okay, we don't need to diagnose anything. We just seen, wow, we got a population of animals, okay, the sickest animals on the planet, which is Americans, and they're having a blood filtration issue. If we went to Canada and look at the caribous and we said, damn, 14% of the caribous got a blood filtration issue, would we look at their diet?
Should.
Yes? Would we look at their environment? Would we think, wow, this is weird? Or would we go up with diuretics and beta blockers? Okay? No, that doesn't make any sense. So you're talking more than 500,000 Americans have kidney failure, 47,000 people a year die, $50 billion a year. So we can go along with the program. If you're not one of the 60% of Americans that have a chronic illness or disease, wait. You're okay now. Okay? If you're taking all the medications, like we literally have had patients come in here, no, my son doesn't have asthma, he takes the steroids and he's fine. My husband doesn't have high blood pressure, he takes the diuretic and he's fine. And it's like, really? So what part of the brain holds common sense? It is missing in you. It's just like mind-blowingly stupid. So the dinosaurs waited, we can't wait for this. So let's look at blood. Let's look at blood. Now this is one of the objective analyses that we use to identify health. Because remember, how can you identify immune system response? I had a really good one last week. Cough and sneeze and sweating and diarrhea. It was amazing. Okay, this is what you're supposed to do. Okay, now this, the slide on the top right, that's bad blood. Okay, what red blood cells look like is they're like two Frisbees glued together. Okay, and they have a beautiful surface area, so it can hold a lot of oxygen, a lot of carbon dioxide, vital for the immune system, regulating pH. It has an absolutely incredible function. Now, under physical, chemical, or emotional stress, the body produces less stomach acid. So the blood cells get sticky, and they start to clump together, and it's called roll of coin or rouleau coin formation. And you'll see these like snake-like structures. Well, think of this. The kidney is a filter. It has hundreds of these little tiny functional units called a nephron that filter it down to one cell. And so if you get these cells clumped together, do you think that that's going to have good oxygen transfer or poor oxygen transfer? Absolutely. There's not a lot of surface area. This would suck. So if you have to get the same oxygen to the same tissue, guess what has to happen to blood pressure if you have unhealthy blood? It has to do what? I know, it has to go up because it's not doing its job. Your blood is inefficient. And you'll see this in pulse pressure right at the low levels. Pulse pressure is the difference between the systolic or the high number and the low number diastolic. So you'll see this difference there, and this is going to clue you into a problem. So you don't need to be like the dinosaur waiting for it. Okay, so we're looking at healthy blood on the bottom right. Now, this is actually the form that we give to our patients, where we got the live blood cell analysis in Mexico. We don't have it up here yet. It's a $15,000 unit, okay, and I'm experimenting around, but it's really cool. I mean, when you get a drop of blood, how many people have seen their own blood? Okay, is that bitchin' or what? I mean, it's like an ecosystem. You get one drop of blood, you see all the cells move in one direction. You see these little platelet guys walking around. Okay, they literally walk on these little fibrins. And then you see neutrophils, you see macrophages engulfing pathogens. I mean, it's in one drop. Okay, it still is a wonderment. So this is, we have a normal one on the left and then the patient's values on the right. And we're looking for the mobility, so how good they're moving, the white cell ratio, membrane integrity, and rouleau coin formation. Now, here's a patient. Now, what you're looking at here, and again, we could be a dinosaur and wait for symptoms. How'd that work out for them? Not good, not good. And knowing that the greatest immunologists on the planet have no way to measure immune system, how about we look at physical, chemical, and emotional stress, knowing that that's the precursor to every disease on the planet, just about, okay? At least 60% of them. So you're looking at a thermography here, and the red spots are hot spots. That means an area of increased metabolic response. It could mean something, it might not. We're looking at the blood cells. They look good integrity on the bottom left, pretty good integrity, but then we're looking at the side view of the neck area, and there's a reverse curve with grade 3 degeneration. So this was a whiplash trauma that she had over 20 years ago. Could have been 30, 40, but it would not be less than 20. So this is a gal with a whiplash trauma over 20 years ago. So if you have a stress for over 20 years, are you in a sympathetic dominant state or in a healthy balance of autonomic function? Does she already have a problem? Yeah, she had it for 20 years. Has she been able to adapt? Yeah, the blood, it's starting to get kind of funky, but it's in the ballpark. But the big thing, if you look at a rib cage area on the far right of the whole body standing there, there's a massive right rotation of the top of the rib cage area. This is a very, very big clue to cardiac arrhythmias and heart palpitations. Because the liver, you've seen the movies where somebody has a heart attack, they grab their left arm. That's because if you irritate the diaphragm on the left-hand side where the heart is, it spasms out the left trap. This is why all the movies show that. Left jaw, left arm, pain, and that's all cardiac issues. Could be. Could also be, hiatal hernia, but, that's kind of what the movies show. If you irritate the diaphragm on the right, where the liver is, that tightens up the right trap. And so the liver is like the detoxifying or enzyme factory that the body has. And the liver has to process all the stress hormones. So physical, chemical, and emotional stress, your body's going to produce nearly identical hormones, and the liver has to work harder and harder and harder, increasing the tone of the right trap. Now the top of the rib cage area is where the nerves that supply the heart, the sympathetic nerves supply to the heart. And this is literally how stress kills. So more stress, more stress, more stress pulls those bones at the top of the rib cage area over. Eventually, there's so much stress that there's a sympathetic charge is fired into the heart, putting the heart in what's called ventricular fibrillation, stopping the heart. So if you're curious at how stress kills, that's literally one of the mechanisms that it can kill. It literally is an off button for the body. So we're looking at this person who's had a 20-year-old injury. Obviously, there's some dental stuff, there's some facial trauma there. And is she healthy? Oh, did we ask how she feels? No, that would be stupid. A person's got 10% awareness of their body. Where are you going to ask that? How about we go to America? Okay, you got pain, neck pain, let's give you a non-steroidal anti-inflammatory. Ibuprofen, Aleve, Motrin, whatever the heck, okay? It destroys the building block of cartilage, increases cardiovascular problems, GI bleeding, GI complications, heart failure, 60%, allergic reactions, miscarriage, and atrial fibrillation. Okay, when you have a patient like this with pain, is there any science, ethics, or morals to provide a non-steroidal anti-inflammatory, or is that completely foolish against human physiology? Completely foolish. Why do they do it? Because it's dogma. Okay, so let's look at this patient. We're looking at, again, neck trauma, phase 3. Of course, the phase is misspelled because we're training down there. And I got to tell you, if you get a medical doctor who is brilliant in Spanish, English, and medical, it's okay if he misspells phase. Okay? I mean, I'm working with some of the sharpest guys down there, and I'm just trying to learn Spanish, and it's just, to learn Spanish in a technical, I just love the guy. But we're looking at clumping of this. We're looking at significant lateral deviations on there. So again, you're looking at a guy with an absolute evidence of physical and chemical trauma. The physical trauma has been there for more than 20 years. Does that make sense? Now, when you're looking at the thermography of the middle area, you're looking at a lot of red up here on the lymph. And lymph is really important. Lymph for the gut drains to the upper left quadrant. So when you look at most breast cancers, lumps, cysts, and tumors, it's in the upper left quadrant. Why? Because most of our diet that we're exposed to now is poisonous and toxic. So when you're talking glyphosate, so genetically modified food, wheat products that are non-organic that have been sprayed with glyphosates, those are natural antibiotics blowing holes in the intestinal tract. Non-steroidal anti-inflammatories damage the mucous membrane, blowing holes in the intestinal tract, increasing intestinal permeability. So when we see hot spots on the left-hand side, we know, damn, there's going to be some gut issues. When we see it on the right-hand side, that's generally chest and face. So you're going to think, dental toxicity is some other kind of problem. So this is just the investigation that we're doing. We can see that the guy has been under physical stress for a while. We're looking at the chemical stress. So then we have to get his body healthy. Does that make sense? Okay. Oh, do you want to know his diagnosis? I don't care. Okay. You can name anything. The diagnosis is only a dogmatic approach to categorize his symptoms into groups so you don't get your ass sued by giving him a poisonous chemical. Okay, that's stupid. Okay, we don't do that stuff. We're going to treat each person like normal. Okay, so let's say you have type 2 diabetes. This is 95% of all diabetics in the world. According to the British Medical Journal, if you give a drug to lower type 2 diabetes, which that person before us is going to have an elevation in blood sugar, you give a drug to lower it 14%, and the blood glucose does go down. Insulin levels remain high, so you have a 43% increase in death. So what is that? You handle the symptoms here with the drug, you increase death. Let's look at this. Now look at that. That's worms on the bottom. That is one of the worst rouleau coin formations that you're going to see and still be in a living person. So do you think that has good oxygen transfer? Okay, so what do you think has to happen to blood pressure when you have blood toxicities like this? It has to go up. Now you're passing this thick sludge through the kidneys, which is the size of your fist, that has to filter, literally 200 quarts of blood a day. Okay, so what's going to happen to the kidneys? You think they're going to be healthy or damaged? So that means long-term blood toxicity is going to also lead to kidney damage. But if you have kidney damage, you're going to have less surface area, so pressure has to increase. So high blood pressure doesn't damage the kidneys. High blood pressure is a response to long-term toxicity. Now, this is the craziest world. If you give this gal a blood pressure drug that lowers her blood pressure down, you're looking at the blood. Okay, now this is only for the people in the audience that have common sense. Okay, you're lowering blood pressure down to really toxic, inefficient blood. Do you think that helps the brain or harms the brain? Really? So does that why the University of Alabama says that if we treat high blood pressure with a blood pressure medication, your risk of stroke increases? Yes, it does. Why? Because the heart isn't the only pump in the body. Okay, you've got all the arteries that constrict and dilate to maintain the level of blood pressure. If you got blood that looks like worms and you're missing that surface area, pressure has to increase. So that means the arteries, if you take a drug to lower it, the body's going to go, whoa, dude, the blood pressure is low and we got toxic, shitty blood. Let's constrict. You constrict it. Do you think those worms are going to be able to flow through there? No, this is why. You take a blood pressure drug, your risk of stroke increases. We want to raise the issue that despite great advances in a pharmaceutical approach, relying on this approach is going to come at a dear price of people's lives. Now, we're looking loss of curve, whiplash trauma. Again, rouleau coin formation. And this is just random groups of patients that we have down at the clinic in Tijuana. And you're looking at big time redness on the right upper chest area. Okay, so now, when you're looking at the dental work, see, when you have a tooth, if you pull the tooth in America, great. You pull the tooth, no problem, take the antibiotic, except they typically don't remove the ligaments that hold the tooth in place. If you don't remove that, you've got dead tissue in there, and it can have a low-grade subclinical infection that starts to rot out the bone and gets toxins into the blood. Okay, how do you know if it's effective or affecting you? Do a thermography. Then we can say, yeah, man, this is something that's got to be taken care of. See, the way a tooth is supposed to be extracted is you pull the tooth, you remove the ligaments, which is really hard. Thank God the dentists down there are good, because who would work hours in a space this big? Oh God, no. I'd be cutting the lips, dropping the jaw, getting in there where I could, because I'm used to working on cadavers. It's way easier. Okay, but that's hard. And so when you're looking at this, to do it correctly, you remove the tooth, remove the ligament, take your own blood, spin it down to plasma cells, inject the opening so the bone can regenerate, you treat it with ozone, and the entire procedure is done with a vitamin C IV. That's Huggins protocol. That's what it's supposed to be done. It obviously wasn't done in this gal. So we look at this, aspirin a day. We're looking at thick blood. Why not an aspirin a day? Well, here's one of the most definitive studies. And again, I'm just talking about giving a toxic chemical to somebody who actually has a stress response. And people come, oh, it's just a baby aspirin, is a little pink sucker. Can't be that bad. Well, it says don't give to children on the back of it. Okay, it says children's aspirin on the front. Then it says, for God's sake, don't give it to a child. They can develop Rye syndrome and kill them. Okay, but it's called baby aspirin. Okay, this, if 100,000 people take it, that means 100,000 people take it, 33 lives could be saved. Okay, that means 99,967. Thank you. Should have calculated that out before I stood up here, I'll tell you that much. Okay, are going to have no benefit whatsoever. Okay, so 33 lives will be saved. However, 117 could die of gastrointestinal bleeding, and 10 will die of stroke. So is there a better way? What thickens blood? Oh, stress. Physical, chemical, emotional stress. How do we know that? I've taken stress extra or the blood cell analysis. Here you go again. Now we're looking at a reverse curve in the neck. We're looking at multiple physical trauma. We're looking at massive redness on the right side. So is his dental work negatively affecting his body? Absolutely. Okay, the blood is toxic and unhealthy. So what are we going to do? Give him a drug? No, that doesn't make any sense. Because when you do this, we have a dementia and Alzheimer's epidemic in this country. Why? Well, it must be inflammation. So you got these guys saying, look, let's give non-steroidal anti-inflammatories and see if it helps brains. What do? Don't! It didn't. Not only did it not help brains, it actually increased Alzheimer's and dementia. So it turns out that inflammation, which is the body's healing process, you can't give a non-steroidal and expect a good outcome. Again, we're looking at massive redness on the thermography, and that doesn't show anything except areas of toxicity, increased metabolic response. It's just a clue that the body's not healthy. Pretty decent curve there. We are looking at some toxicities, but some significant disc injuries in his low back. When we look at this one, we're looking at, again, unhealthy blood. We're looking at inflammation on the right side. But look at the reverse curve in the neck. Again, this is a trauma. Normal human necks curve in the front. So you get somebody under a trauma, 8, 10, 12, 20 years. What's their body going to be like? Had a 10-year-old kid in today. His mother gives him Benadryl in order to sleep. Okay, has anyone seen the study on Benadryl in 10-year-olds? No, because there isn't one. Okay, if the antihistamine drugs cause Alzheimer's in adults, what's it doing to a 10-year-old kid? Okay, this is the stuff I deal with every day. It's nuts. This, again, you're looking at clumped blood, good curve in the neck, degeneration, trauma. The curve in the neck is pretty good, but we're looking at other stressors. So what's her diet like? What's her medication use like? So what's her water intake like? Does that make sense? So we just go through and look at the physical, chemical, and emotional stressors. This way you're actually looking for normal. This guy, you're looking at horrible worm-like structures, which is rouleau-coin formation, but he has a beginning autoimmune condition called diffuse idiopathic skeletal hyperostosis. You can kind of see it a little bit in the neck. When you're watching this on YouTube, you can blow it up. It'll be really easy. It'll be put on next week. But you have to have 3 segments involved in order to have this diagnosis. He has 1.5. So what do? Not tell him? He doesn't have it yet. Okay, do you see how crazy this is? But when he has 3 segments, the diffuse idiopathic skeletal hyperostosis, which is called DISH, okay, it's also called Fostier's disease, okay, for when you do your boards, okay, you'll remember this. Okay, so you look at this and it's just like, this is not the body attacking itself. This is incredible toxic reaction to the body. I mean, what's happening is the ligament in front of the vertebrae, which ligament's got to be really healthy tissue, and that's metabolically expensive. That takes a shitload of amino acids, okay? And it's hard to break the proteins to amino acids. So you're looking at long-term stress, so the guy cannot break the proteins to amino acids. So the body, instead of building beautiful, flexible, strong, healthy ligaments, it chooses a cheaper mineralized product. So people will call it calcium deposits, not calcium, that's ignorant. Okay, it's an ossification. It's literally the body changing a very expensive product, which is a ligament, for something stiffer. Okay, I mean, it's just that. It's that chronic stress. And what's the official cause of this, the diffuse idiopathic skeletal hyperostosis? What's the official cause? Unknown. Okay, when you can see that there's trauma, there's damage, there's stress. People who are diagnosed with heart failure following a treatment regime of blood thinners, aspirin, or Coumadin could be putting their health into more danger. Based on the results of the study, experts said that treatment of heart failure involving a multitude of drugs that proved to be ineffective should be eliminated as a treatment option. Shayna, stop all those ineffective drugs. It's not a good option. I thought ineffective was decent. Honest to God. And this was in 2004, so this was years before weed was legal. Okay, so I mean, I'm just reading the studies. It's nuts. Do you want to see what breast cancer looks like? Okay, that redness on that thermography, this is massive. And now this is a metabolic disease. Cancer is a disease of metabolism. It's a long-term poisoning of the body. So when we look at this, that's the upper left quadrant. So what does she have? Massive leaky gut. And then when we look at the rib cage here, I blew this one up so you could see the massive rotation. So this is huge physical, chemical, and emotional stress right here. So how are you going to fix this, okay, with chemotherapy, surgery, and radiation without addressing the underlying stressors? Impossible or impossible? Impossible. It's just such a dogmatic approach with no common sense, no thought to the normal physiologic response that this person has. Let's look at the kidney, the blood filter. I mean, you saw blood after blood after blood, and you know that if you are in a stress state, your kidney's got to work harder. Okay, the functional unit's the nephron. I mean, and these little tiny tubules, okay, go down to 1 cell thick, so everything gets filtered out and then filtered back. When you're looking at it, 200 quarts of blood a day, okay, go through this, and they're the size of your fist. They're so important. You can have you have 2 of them. You can live with 1 of them. So that means that the blood can go there. Now, 15% of all the people on dialysis are there because Tylenol and aspirin. Okay, what's the purpose of aspirin? Well, it doesn't help the heart. What's the purpose of Tylenol and aspirin for joints? Well, it destroys the proteoglycan production, so it builds the joint. It destroys the joint cartilage. And do you know what people will say? Well, I had to take it to take the edge off. Okay, it doesn't work. It's destroying your body. Okay, there's a lot of other pain relievers that you can do to allow the inflammation to heal the body. Does that make sense? This is what we're dealing with. We're dealing with things, physical, chemical, and emotional stressors. This is the mom. Okay, and right now, if she had 36 vaccines, that means she's in her 30s. Okay, if a mom is in her 20s, she's had around 72 vaccines. Okay, because they're going up exponentially. as there's no liability, the vaccine lobby is just going crazy. So, of course, they were taught by their doctor that food doesn't really matter, so they're eating the genetically modified foods, they get the flu shot every year, and they're getting the healthy choice microwavable meals. Okay, they mate. Okay, the mom gets Pitocin and an epidural. Why? Because that's standard process, even though Pitocin increases the risk of vaccine damage 60%. Of course, the mom with the Pitocin and the epidural, she can't produce milk, so she has the genetically modified based formula, whose first ingredient is genetically modified high fructose corn syrup. And she's giving this to this kid, and the kid will throw up because the kid is smart. Okay, and then the doctor at a 1 month old will give the child an antacid to stop him from throwing up. Okay, now I'm telling you, any chiropractors in the audience, okay, if there were, okay, they would raise their hands and just say, yeah, I hear that all the time. This is standard operating procedure. When people with common sense say, my God, that's insane. Okay, we now have 72 doses of 17 different vaccines, and in fact, people were starting to question this in every state. In California, they decided to take the parents out. That didn't work because some medical doctors were still writing exemptions. They wanted to treat each person as an individual. So now they took the medical doctors out. Now only the state's involved. The adult vaccine is coming next year. And why am I putting this up? We have 3 stressors. We have physical, chemical, and emotional stress. This is a massive chemical stressor. Okay, and this will be forced on you, and it's forced on our kids. How do we know this? Because 54% have a chronic illness or disease. We know that vaccines can increase intestinal permeability. And what's interesting is nobody's ever tested the multiple vaccines in a human being. We do know, and this is kind of interesting. This is out of 1986. They took 2 different viruses, okay, both I think from the herpes family, and they injected one virus in the mice, nothing happened. Okay, they injected the other virus in another mouse, nothing happened. And in fact, they put 100 times the dose inside of one mouse of one virus, and nothing happened. The mouse lived. But they mixed the 2 viruses, and 62% of the mice died. So there's an interaction between viruses, and nobody knows why. Now, it's interesting that this was in '86 because that's the year that the no liability for vaccine law was passed. So now there's no liability in a product that's forced to you that no longer has a medical doctor that can give you an exemption. It's now by the state. Bovine serum albumin. Now this is out of cows, and it's used in food processing. It turns out that it damages the kidneys. Okay, kidneys are important, that's the blood filter. It also turns out that the growth serum of vaccines, of a good hunk of them, including the MMR, comes out of this bovine growth, and this can cause an allergic reaction to the vaccine. What's an allergic reaction? That's an abnormal recognition of a foreign protein. This is why you can't open that bag of peanuts on a plane, because someone will stroke out or go into anaphylactic shock. This is why we have peanut-free days at ballparks. So no longer can you get peanuts, popcorn, okay, because the population is so hypersensitive now. Our population is really sick. What do you think the kids' blood today would look like? Okay, knowing that they've had antibiotics, vaccines, everything else. What do you think it would look like? It's mind-boggling. We have to look in, because there's zealots doing a dogmatic approach, calling people that are questioning the science, which by God, everybody should question the science all the time. So that's the only way science progresses. If you look at history, granted, it was really long ago. We're talking just like 10 years ago. Okay, but if you look at this, polio, measles, pertussis, how long was it? I mean, how many people were not affected by it? How with pre-vaccine, these viruses and diseases went through the population, and you're looking at 99.998% of the population was never affected by it after clean water and sanitation. before, and all this panic. You know, it's those damn anti-vaxxers, the unvaccinated kids that are spreading disease. This was the disease or the vaccine coverage rates in 1985 before they passed the law. We just have to change this. So we've got a choice currently, okay? And you'll see the handout that you have. I don't have one of the handouts, but you'll see the handout that you have is for civil disobedience. Okay, there is no liability on the vaccine product. Okay, no, that's okay. I know, believe me, I know about heart, hon. Okay, so there's no liability. There's no liability from the manufacturer. There's no liability from the doctor. There's no liability from the nurse. It doesn't matter. So this is where the buck stops here. You can copy this. I got it. You can get it from vaclib.org. Okay. The physician, if he's going to inject this in you, then he should take responsibility for that medical procedure. I think he should take responsibility for the Tylenol and the Motrin and the beta blocker and the diuretic. I think there should be an outcome assessment, okay? Because honest to goodness, the outcome assessment is here. We'll do post x-rays and everything else. But if you get a diuretic or a beta blocker or an ACE inhibitor, they're not going to follow you along and find out that you got ED and sleep problems and anxiety and stress, but your blood pressure's fine. You know, let's go on the real. So I'm going on vitalism versus mechanism. I think my body is intelligent. I prefer conservative therapies. I think my body is self-healing and self-regulating. I mean, we got to stop this. These are not diseases. They're an adaptive physiologic response to chronic toxicity and deficiency. This is what we're going to do. We're going to change all of this. You fix the physical, chemical, emotional stress. Now, how would you like to learn one of the keys for the cures for cancer, atherosclerosis? Well, we know what causes that anyway. Heart attacks, diabetes, allergy, Crohn's, multiple sclerosis, Alzheimer's, osteoporosis, psoriasis. You see all of these diseases? How can these diseases be positively affected or eliminated by fresh fruits and vegetables? It can't be that simple. There has to be some other cause. Do you know what I mean? Because the fruits and vegetables have antioxidants and they help inflammation actually do its job to regenerate the tissue. It can't be that easy. Can it be that easy that what we put in our mouth changes our blood and our blood efficiency changes the nutrients going to the tissue and coming away? It can't be that easy. Is it that easy? It is. I mean, this is why we, I think we got around an 8,000 square foot clinic down there. Okay, we got the dental, the stem cells, the surgery, the detoxing, the neurologic, the chiropractic. I mean, this is really a cool center. But we have to change this. I mean, if you haven't been on Extreme Health Academy, here's 2 weeks for free. Type in Bergman 14, get there. And the trip is, look at the forums. Okay, the forums, you're going to find people that have had every kind of disease known, and they found solutions for it. It's like when you go to the clinic down in Mexico, Alessandro's had the dental portion going for 25 years, and you'll see people that used to have pancreatic cancer, they used to have liver cancer, they used to have these cancers, and it's just like, well, what did you do? Well, I detoxed, I got this, I maintained the health. This is going to be the future. The future is going to be clinics like this, that they're going to do an objective analysis to measure your health. They're going to see how you sleep, how you eat, how you function, not waiting for a disease, giving you a diagnosis, and then giving you a toxic chemical. That doesn't work. It's not working for Americans. Support this. Go to Extreme Health Academy and YouTube. God knows how long it's going to be on there. Copy all the videos. Okay, don't just copy the URL. Okay, and this. When we put this up, can you see how simple it is? If you're in a stress state, your nervous system has to be altered to your perception. Regular exercise, man, we're just talking at least every day. Okay, half hour a day. It doesn't take much. If you're wheelchair bound, you can use arms. Proper nutrition, that means if man makes it, you don't eat it. Sufficient rest, prayer, and meditation. Puerto Vallarta is coming up. It's in a few months. It's in November 14th to 17th. Get down there. It's going to be a blast. We're going to be teaching from 8 in the morning to 12. We're going to be mainly focusing on brain health, neuroplasticity, and how the brain works. We are going to have continuing ed credit, so that'll be kind of cool. But it's just fun to take an hour flight down to Puerto Vallarta and just hang out. But the cruise in April, I know it sounds weird because I don't like to plan stuff like 7-8 months in advance, but the cabins are going. If you're even remotely thinking about going and you want a cabin with a good balcony, sign up for it. You know, go to our website and get on there. But how many people have been to Greece, Crete, Jerusalem? I haven't been to those places. You have. I know, you're a doc. You go everywhere. Okay, so we're going to change this world. Okay, does that make sense? Okay, now, any questions? Because next week we're going to talk about the neurology behind it and how to regenerate brains, or civil disobedience. Thank you very much. God bless you.